What would happen if I told you that, without realizing it, your body after 50 starts to change in silence, robbing you of strength, mobility, and balance? Yes, as you heard correctly, starting at 50, and even more intensely after 60, muscles begin to lose strength naturally, and little by little simple activities that you perform daily can feel more difficult than they were before. This process is called sarcopenia, and although it is part of aging, its consequences go beyond the physical. It affects safety, confidence, and, most valuable, independence. Just one fall is enough for your life to take an unexpected turn, and that fear of losing stability often leads to moving less, generating a vicious cycle of weakness and limitations. But I want you to know something very important. It's not too late to recover strength, balance, and vitality. Science has shown that, with the right movements, your body can respond positively at any stage of life. You don't need weights, expensive machines, or long hours in a gym. What you really need is consistency, intention, and a series of exercises that activate the key muscles that protect your mobility. And that is why, in this video I am going to teach you 5 functional, safe, and easy-to-follow exercises, designed especially for those who have passed 50 and want to stay firm and active at this age. They are movements backed by medical studies that have proven they can reduce the risk of accidents by up to 30%, improve posture, relieve discomfort in the back and joints, and above all, give you back the security of moving with freedom. The best part is that you'll be able to do them at home, dedicating only a few minutes of your time, adapting them to your own pace and regardless of how long you've been without exercising. So let's begin. Exercise 1. Walking. Walking, at first glance, may seem like an activity too simple to be considered a transformative exercise, but science has cataloged it as one of the most powerful tools to maintain health, autonomy, and quality of life in maturity. Starting at 50 years old, the regular practice of walks not only helps counteract the natural loss of muscle mass, but also strengthens bones, lungs, and heart in a safe and progressive way. Studies published in the British Journal of Sports Medicine have demonstrated that walking between 20 and 30 minutes a day significantly reduces the risk of cardiovascular diseases, type 2 diabetes, and certain types of cancer, while contributing to improved blood circulation and cerebral oxygenation. Another impactful finding comes from Harvard Medical School research, which indicates that walking consistently can increase life expectancy by up to 7 years, even in people who start the habit after 60. But the benefits don't stop just at the physical. Walking stimulates the release of endorphins, neurotransmitters responsible for the sensation of well-being, which decreases levels of anxiety, stress, and depression, conditions very frequent in old age. Additionally, by continuously activating the muscles of the lower body, especially quadriceps, hamstrings, calves, and glutes, walking becomes a natural defense against sarcopenia and loss of balance, 2 of the greatest risk factors for falls and fractures in older adults. In fact, a study from the Journal of Geriatric Physical Therapy found that older adults who walked at least 150 minutes a week reduced by 33% the probability of suffering falls, thanks to improvement in motor coordination and proprioception, that is, the body's ability to recognize its position in space. On the other hand, walking is not only a physical exercise, it is also a practice of cognitive and social stimulation, which makes it an integral habit for well-being. Recent research from the National Institute on Aging indicates that walking regularly activates brain areas linked with memory and attention, reducing the risk of cognitive deterioration and neurodegenerative diseases like Alzheimer's by up to 40%. This benefit is enhanced when walks are performed outdoors, since moderate exposure to sunlight favors the synthesis of vitamin D, essential for bone health and immune function, in addition to helping regulate sleep cycles. In metabolic terms, walking is also key. According to the American Diabetes Association, walking after meals reduces glucose spikes in blood, a decisive factor to prevent or control type 2 diabetes, a condition that affects millions of older adults worldwide. Even walking speed has become a clinical indicator of longevity. A study published in JAMA revealed that older adults with a walking speed greater than 1 meter per second had a higher probability of living more years compared to those who walked slower. All this converts the everyday act of walking into a true, natural medicine, accessible, free, and adapted to each person, that not only strengthens the body, but also protects the mind and spirit. That's why, when we talk about active longevity and aging with dignity, walking should not be seen as a simple pastime, but as a fundamental pillar of preventive health. Exercise 2. Arm raises with dumbbells. This exercise primarily works the lateral deltoid, but also activates stabilizer muscles like the trapezius and supraspinatus, essential for maintaining correct posture and shoulder joint mobility. Why is this so important after 50? Because the shoulder is one of the joints with the greatest range of movement in the human body, but also one of the most vulnerable to injuries and wear, especially when the supporting musculature is not sufficiently strengthened. Research published in the Journal of Aging shows that resistance training programs in older adults significantly improve functional strength of the upper body, which translates to greater ease in performing daily activities like lifting shopping bags, reaching objects on high shelves, or even maintaining stability when walking while supporting oneself on railings. Additionally, strengthening shoulder muscles through simple exercises like lateral raises with dumbbells helps reduce the incidence of chronic pain in the scapular and cervical region, very frequent in older people due to loss of muscle tone and bad postures acquired over time. What's most interesting is that heavy dumbbells are not needed to obtain results. Studies from the American College of Sports Medicine highlight that, in older adults, even light loads of 1 to 3 kilograms can stimulate positive muscular and neurological adaptations, as long as they are performed with good technique and consistency. Beyond the physical benefits, this exercise also has an impact on fall prevention and preservation of functional independence. By strengthening the upper body, arm raises with dumbbells improve the ability to react and support oneself in case of stumbling, which provides an extra layer of safety to daily mobility. A study from the Journal of Strength and Conditioning Research found that older adults who included resistance exercises for the upper body achieved not only greater strength, but also improvements in dynamic balance, which reduces by up to 20% the probability of accidents related to falls. At a metabolic level, resistance exercises like arm raises favor the increase of lean muscle mass, which accelerates basal metabolism and helps control body weight, a key aspect for reducing the risk of chronic diseases like type 2 diabetes and hypertension. It's also relevant to mention that this type of training stimulates bone mineral density in the scapular and humeral region, decreasing the risk of fractures due to osteoporosis, a condition that affects 1 in 3 women and 1 in 5 men over 50 years old, according to the International Osteoporosis Foundation. Additionally, regular practice of resistance movements increases the production of growth factors and anabolic hormones, like IGF-1, which are linked with cellular repair and healthy longevity. In short, arm raises with dumbbells are not just an exercise to tone the arms. They are an integral strategy to maintain strength, posture, balance, and vitality in maturity. The best part is that they can be adapted to any fitness level, whether using dumbbells, water bottles, or even elastic bands, which makes this movement accessible, safe, and highly effective for those seeking to maintain their independence and quality of life after 50. Exercise 3. Flexibility exercises. Flexibility is a fundamental physical capacity that frequently goes unnoticed compared to strength or endurance, but plays a determining role in quality of life as we age. With the passage of years, body tissues experience progressive changes, muscles lose elasticity, tendons shorten, ligaments become more rigid, and joint mobility decreases. This natural process is intensified by sedentary lifestyle, bad postural habits, and the presence of degenerative diseases like arthrosis or osteoporosis. Loss of flexibility not only limits the range of motion of joints, but also increases the risk of injuries and reduces the capacity to perform activities as everyday as getting dressed, bending over, or turning the torso when walking. Science confirms it. A study published in the Journal of Aging Research showed that older adults with regular stretching programs experienced significant improvements in joint mobility, balance, and coordination, reducing by more than 25% the risk of falls. Additionally, maintaining flexibility through active or passive elongation exercises favors muscle health by increasing blood circulation, improving oxygen and nutrient supply, and facilitating the elimination of metabolic waste products, which translates to faster recovery and lower incidence of chronic pain. Simple exercises like neck stretching, gently tilting the head to one side and holding for 20 seconds, arm and shoulder stretching, bringing one arm crossed over the chest and holding it with the other hand, or calf stretching, placing hands on the wall and keeping one leg back with the heel on the ground, are practical examples that can be done at home without need for special equipment. Even the World Health Organization recommends including flexibility activities in exercise programs for older adults at least twice a week, with sessions of 30 to 60 minutes, where each stretch is held between 15 and 30 seconds, progressively and without abrupt bouncing, to maximize benefits and minimize risks. The benefits of flexibility exercises transcend the physical, reaching psychological and social dimensions that directly impact independence and active longevity. Better range of motion allows executing daily life tasks with greater ease, from tying shoes to raising arms to take an object from above, and this autonomy impacts self-esteem and personal security. Studies from the American College of Sports Medicine, ACSM, indicate that programs that combine stretching with functional exercises improve not only mobility, but also dynamic balance and neuromuscular coordination, key factors to prevent falls, the main cause of disability in people over 65 years old. Therefore, it's key to integrate flexibility routines with movements like back stretching, cat-cow style, gently arching and curving the spine in 4-point support position, seated hip stretching, bringing one ankle over the opposite knee and slightly flexing the torso forward, and lateral trunk stretching, standing, raising one arm and flexing the torso to one side. These exercises not only increase joint range, but also relieve frequent pain in the lumbar area, hip, and shoulders. Additionally, stretching favors relaxation of the parasympathetic nervous system, which reduces blood pressure, decreases stress, and improves sleep quality, something that is especially valuable in a life stage where insomnia and rest disorders are frequent. It's also relevant to emphasize that maintaining good flexibility is related to cognitive health. By improving circulation and cerebral oxygenation, stretching contributes to the preservation of functions like memory and attention. In this sense, the act of stretching should not be seen as a simple complement to exercise, but as an integral preventive and therapeutic tool. Exercise 4. Shoulder flexion with dumbbells. Shoulder flexion with dumbbells, performed correctly and progressively, is one of the most effective exercises to maintain health, strength, and mobility of the shoulder joint, one of the most used and, at the same time, most vulnerable in daily life. With the passage of years, the deltoid, trapezius, and pectoral muscles tend to lose tone and volume, which limits the ability to raise arms, reach objects, or even maintain an upright posture. This weakening, added to the natural wear of tendons and cartilage, favors the appearance of problems like joint stiffness, rotator cuff syndrome, or shoulder arthrosis. The good news is that exercises like shoulder flexion help prevent these problems by strengthening the upper body musculature and stimulating joint mobility. Research published in the Journal of Strength indicates that light resistance training programs in older adults generate a significant increase in functional strength of the upper body, improving the ability to perform activities as simple as carrying bags, pushing a door, or getting up with support. Additionally, this type of movement stimulates bone mineral density in the scapular and humeral region, which contributes to reducing the risk of fractures due to osteoporosis, a condition that especially affects women over 50 years old. Even with light loads, like dumbbells of 1 to 3 kilos or water bottles, considerable improvements in strength, coordination, and range of motion can be achieved. Another key aspect is posture. By keeping the back straight and feet well supported on the ground, this exercise also activates core stabilizer muscles, which reinforces general balance and safety in daily mobility. The benefits of shoulder flexion go beyond physical strengthening, as they also affect fall prevention, functional independence, and emotional well-being. A study published in the Journal of Aging and Physical Activity demonstrated that older adults who perform resistance exercises for the upper body present a notable improvement in confidence when moving, which reduces the fear of falling, a psychological factor that often limits more than physical weakness itself. By working the deltoids and scapular stabilizer muscles, this movement favors neuromuscular coordination and proprioception, that is, the body's ability to perceive and control the position of its segments in space, something essential to maintain stability when performing everyday movements. On the other hand, regular practice of exercises like shoulder flexion contributes to regulating basal metabolism, helping to control weight and improve insulin sensitivity, which is key in preventing metabolic diseases like type 2 diabetes. It also stimulates the release of endorphins, neurotransmitters related to well-being, that reduce stress and anxiety, improving mood in a life stage where many people experience important emotional changes. What's most motivating is that it's an accessible and adaptable exercise. It can be done sitting in a chair without arms, at home, with controlled and safe movements, adjusting weight and number of repetitions to individual possibilities. In this way, shoulder flexion is not just a strength exercise, but an integral tool that protects joints, stimulates bone density, strengthens posture and, above all, preserves independence and confidence, fundamental values for enjoying an active and full life after 50. Exercise 5. Leg raises. Leg raises is a simple exercise, but of great impact on integral health, especially in older adults, as it directly strengthens the musculature of the abdomen, hip, and lower body. The activation of deep abdominal muscles, like the transverse and obliques, plays a key role in spinal stabilization and in the prevention of lumbar pain, one of the most common discomforts in people over 60 years old. Studies published in the Journal of Orthopedic and Sports Physical Therapy indicate that strengthening the core not only protects the lumbar area, but also improves posture and reduces the risk of falls, by providing greater stability during gait and position changes. At the same time, leg raises involves the iliopsoas and rectus femoris, fundamental muscles for lifting legs when walking, climbing stairs or getting up from a chair. Their frequent training translates to better functional capacity and greater independence in activities of daily living. Additionally, this movement contributes to maintaining hip mobility, which is essential to prevent joint stiffness and loss of range of motion that accompanies aging. Research on aging and sarcopenia, the progressive loss of muscle mass with age, demonstrates that resistance exercises, even with one's own body weight, help conserve muscle and stimulate protein synthesis, delaying this degenerative process and improving quality of life. In the case of leg raises, sophisticated equipment is not required. It can be performed lying down, sitting in a chair or even standing, adapting to the needs and fitness level of each person, which makes it an accessible and safe tool to maintain lower body and core strength in older adults. Beyond the musculoskeletal benefits, leg raises also has a significant impact on metabolic health, circulation, and cardiovascular function. By dynamically activating the muscles of the legs and abdomen, this exercise promotes greater venous return, favoring blood circulation toward the heart and reducing the sensation of heaviness in the lower extremities, a frequent problem in people with venous insufficiency or varicose veins. Research in the European Journal of Applied Physiology shows that exercises that involve repeated contraction of large muscle groups, like those of the legs, improve insulin sensitivity and favor glycemic control, which is especially beneficial for the prevention and management of type 2 diabetes. At the same time, this practice contributes to caloric expenditure and maintenance of healthy body weight, reducing abdominal fat, a risk factor associated with cardiovascular diseases. Another aspect to highlight is its positive effect on mental health. By performing leg raises regularly, the release of endorphins and serotonin is stimulated, neurotransmitters that improve mood, reduce stress, and strengthen motivation. From a functional standpoint, integrating this exercise into the daily routine means training basic movement patterns that are constantly used, like lifting feet to avoid tripping, maintaining stability when climbing steps, or performing everyday tasks that require lower body strength. What's most inspiring is that older adults who practice this type of exercise report feeling more secure, active, and autonomous, which reinforces not only their physical well-being, but also their self-esteem and confidence in their ability to remain independent. In this way, leg raises is not simply an abdominal or hip exercise, but an integral health strategy that strengthens muscles, improves circulation, optimizes metabolism, and preserves autonomy, essential values for living with energy and fullness after 50 years. Current science demonstrates that the key to healthy aging does not lie solely in living more years, but in living them with mobility, strength, and autonomy. The exercises presented in this video, walking, arm raises with dumbbells, flexibility movements, shoulder flexion, and leg raises, represent an integral strategy to combat the most notorious effects of aging: sarcopenia, loss of muscle mass, joint stiffness, decreased aerobic capacity, and deterioration of balance. Walking, for example, not only strengthens the cardiovascular system and improves circulation, but also regulates metabolism and stimulates the release of endorphins, reducing the risk of depression and anxiety in older adults. For their part, arm raises and shoulder flexion not only maintain strength in the upper body, key for activities as everyday as carrying bags or lifting objects, but also reinforce bone mineral density, preventing osteoporosis and reducing the risk of fractures. Flexibility exercises play a central role in preserving range of motion and in fall prevention, since a rigid body with reduced mobility is more vulnerable to injuries even in simple tasks. Finally, leg raises strengthen the core and hips, improving balance, posture, and safety when walking, essential aspects for maintaining functional independence in advanced ages. What's most relevant is that, when combined, all these exercises work synergistically on the main body systems: musculoskeletal, cardiovascular, metabolic, and neurological, creating an integral protective effect that can significantly delay the effects of aging. In this way, incorporating these practices consistently generates benefits that transcend the physical and reach the psychological and social dimension. Studies published in the Lancet Healthy Longevity have demonstrated that physically active older adults present 30% less risk of developing chronic diseases like hypertension, diabetes, or cognitive deterioration, and also report greater emotional well-being and confidence in their ability to face daily life. These exercises, being simple and adaptable, eliminate the barrier of "I can't" that many older people feel when they think about physical activity, showing that a gym or intense routines are not needed to obtain significant results. Even more, they become a tool of empowerment. Each step when walking, each repetition with dumbbells, each stretch or leg raise, symbolizes a victory against sedentary lifestyle, frailty, and dependence. In this way, exercise stops being a simple mechanical movement to become an act of self-care and dignity, a conscious investment in the possibility of continuing to enjoy life with energy, security, and autonomy. Having reached this point, it's clear that movement is not a luxury, but a vital necessity to keep ourselves strong, autonomous, and full of energy after 50, 60, or even 80 years. Each exercise we saw, walking, raising arms with dumbbells, working flexibility, strengthening shoulders, and lifting legs, is not simply a physical gesture, but an investment in your health, your independence, and, above all, in your quality of life. It doesn't matter if today you start with small steps or with few repetitions. What's important is taking the first step, because every movement counts and every active day adds years of vitality. Now I invite you to take action, dedicate a few minutes a day to your well-being. Start today with these exercises and see in just a few weeks how your body responds with more strength, more balance, and more confidence. And if you want to keep learning more simple, effective routines backed by science, don't forget to subscribe to the channel, give this video a like, activate the notification bell, and share it with your family and friends. Remember, the best time to start taking care of yourself is now, because it's never too late to feel strong again and master of your life. Your body and your health will thank you. Thanks for watching this video and see you soon.